Hello friends, welcome to my YouTube channel. Today we are going to discuss about the cholinergic drugs. This makes good university question, so let's begin. Cholinergic drugs, cholinomimetic, parasympathomimetic. These are drugs which produce actions similar to that of ACH, either by directly interacting with cholinergic receptors, cholinergic agonists, or by increasing availability of ACH at these sites, anticholinesterases. Trick to remember its classification has been covered in another video. You can check that later. Firstly, let's see its action on various systems. Acetylcholine as a prototype. Muscarinic actions. 1. Heart. ACH hyperpolarizes the SA nodal cells and decreases their rate of diastolic depolarization. As a result, rate of impulse generation is reduced, bradycardia or even cardiac arrest may occur. At the AV node and his Purkinje fibers refractory period, RP, is increased and conduction is slowed. PR interval increases and partial to complete AV block may be produced. The force of atrial contraction is markedly reduced and RP of atrial fibers is abbreviated. Due to non-uniform vagal innervation, the intensity of effect on RP and conduction of different atrial fibers varies, inducing inhomogeneity and predisposing to atrial fibrillation or flutter. Ventricular contractility is also decreased, but the effect is not marked. The cardiac muscarinic receptors are of the M2 subtype. 2. Blood vessels. All blood vessels are dilated, though only few, skin of face, neck, salivary glands, receive cholinergic innervation. Fall in BP and flushing, especially in the blush area, occurs. Muscarinic, M3, receptors are present on vascular endothelial cells. Vasodilatation is primarily mediated through the release of an endothelium-dependent relaxing factor, EDRF, which is nitric oxide, NO. 3. Smooth muscle. Smooth muscle in most organs is contracted, mainly through M3 receptors. Tone and peristalsis in the gastrointestinal tract is increased and sphincters relax. Right pointing arrow. Abdominal cramps and evacuation of bowel. Peristalsis in ureter is increased. The detrusor muscle contracts while the bladder trigon and sphincter relaxes. Right pointing arrow. Voiding of bladder. Bronchial muscles constrict. Asthmatics are highly sensitive. Right pointing arrow. Bronchospasm. Dyspnea, precipitation of an attack of bronchial asthma. 4. Glands. Secretion from all parasympathetically innervated glands is increased via M3 and some M2 receptors. Sweating, salivation, lacrimation, increased tracheobronchial and gastric secretion. The effect on pancreatic and intestinal glands is not marked. Secretion of milk and bile is not affected. 5. Eye contraction of circular muscle of iris resulting in miosis. Contraction of ciliary muscle causing spasm of accommodation, increased aqueous outflow facility, reduction in intraocular tension, especially in glaucomatous patients. Nicotinic action. 1. Autonomic ganglia. Both sympathetic and parasympathetic ganglia are stimulated. This effect is manifested at higher doses. High dose of ACH given after atropine causes tachycardia and rise in BP due to stimulation of sympathetic ganglia and release of catecholamines. 2. Skeletal muscles. Iontophoretic application of ACH to muscle endplate causes contraction of the fiber. Intraarterial injection of high dose can cause twitching and fasciculations, but I versus injection is generally without any effect, due to rapid hydrolysis of ACH. CN's actions. ACH injected I versus does not penetrate blood-brain barrier and no central effects are seen. However, direct injection into the brain produces arousal response followed by depression. Cholinergic drugs which enter brain produce complex behavioral and neurological effects. Now let's see the description of each individual drug. Therapeutic uses of muscarinic receptor agonists. Acetylcholine, although rarely given systemically, ACH is used topically for the induction of meiosis during ophthalmologic surgery. Instilled into the eye as a 1% solution. Methacholine is administered by inhalation for the diagnosis of bronchial airway hyperreactivity in patients who do not have clinically apparent asthma. Muscarinic agonists can cause bronchoconstriction and increased tracheobronchial secretions in all individuals. Asthmatic patients respond with intense bronchoconstriction and a reduction in vital capacity. Contraindications to methacholine testing include severe airflow limitation, recent myocardial infarction or stroke, uncontrolled hypertension, or pregnancy. Bethanechol primarily affects the urinary and GI tracts. In the urinary tract, bethanechol has utility in treating urinary retention and inadequate emptying of the bladder when organic obstruction is absent, as in postoperative urinary retention, diabetic autonomic neuropathy, and certain cases of chronic hypotonic, myogenic, or neurogenic bladder. Catheterization can thus be avoided. When used chronically, 10 to 50 mg of the drug is given orally 3 to 4 times daily. The drug should be administered on an empty stomach, i.e., 1h before or 2h after a meal, to minimize nausea and vomiting. In the GI tract, bethanechol stimulates peristalsis, increases motility, and increases resting lower esophageal sphincter pressure. Bethanechol formerly was used to treat postoperative abdominal distension, gastric atony, gastroparesis, adynamic ileus, and gastroesophageal reflux. Carbachol is used topically in ophthalmology for the treatment of glaucoma and the induction of meiosis during surgery. It is instilled into the eye as a 0.01% to 3% solution. Pilocarpine hydrochloride is used for the treatment of xerostomia that follows head and neck radiation treatments or that is associated with Sjogren's syndrome. The usual dose is 5 to 10 mg 3 times daily. The dose should be lowered in patients with hepatic impairment. Pilocarpine is used topically in ophthalmology for the treatment of glaucoma and as a miotic agent. It is instilled in the eye as a 0.5% to 6% solution and also can be delivered via an ocular insert. Cevimeline is a muscarinic agonist that seems to preferentially activate M1 and M3 receptors on lacrimal and salivary gland epithelia. Contraindications, precautions, and adverse effects. Most contraindications, precautions, and adverse effects are predictable consequences of muscarinic receptor stimulation. Thus, important contraindications to the use of muscarinic agonists include asthma, chronic obstructive pulmonary disease, urinary or GI tract obstruction, acid peptic disease, cardiovascular disease accompanied by bradycardia, hypotension, and hyperthyroidism. Muscarinic agonists may precipitate atrial fibrillation in hyperthyroid patients. Common adverse effects include diaphoresis, diarrhea, abdominal cramps, nausea, vomiting, and other GI side effects, a sensation of tightness in the urinary bladder, difficulty in visual accommodation, and hypotension, which can severely reduce coronary blood flow, especially if it is already compromised. These contraindications and adverse effects are generally of limited concern with topical administration for ophthalmic use. Poisoning from the ingestion of plants containing pilocarpine, muscarine, or auriculine is characterized chiefly by exaggeration of their various parasympathomimetic effects. Treatment consists of the parenteral administration of atropine in doses sufficient to cross the blood-brain barrier and measures to support the respiratory and cardiovascular systems and to counteract pulmonary edema. Like, share and subscribe for new videos. Thank you.